Hello, everyone. Welcome back to another episode of the NJ1ST podcast. My name is Ryan McDonald. I have another guest joining me today, a candidate for the Republicans in Congressional District 3, Rajesh Mohan. Thank you for joining us today.
Thank you, Ryan. Thank you for the opportunity and thank you for the platform to speak directly with the voters. I think it's awesome that you provide this service to the candidates and really indebted for that. Thanks so much. Um, as you said, my name is Rajesh Mohan. I'm a longtime resident of New Jersey, um, married to my wife of about 33 years. My kids, they grew up in New Jersey. One is a quantum engineer trying to change the world and make it a better place, and the other one is a freshly minted lawyer. So I owe a lot to New Jersey for their upbringing. It takes a village, and I want to just give back. But the main reason I'm running for the congressional seat, I believe, is the platform that was created since my childhood by my parents, Janak and Arima, who taught me to speak up in the defense of right and fight against wrong. They taught me to never take anything for granted, always work hard, and leave nothing to chance. There is a very strong sense of strength of empathy, which I believe they embedded in me since my childhood. And a lot of people think that empathy is a soft quality, so to speak. But I believe empathy is a very powerful strength, which gives you the conviction to fight against wrong and make things right. And I've been guided by the teachings, upbringing of my parents, my grandfather. The motto of my high school was service before self. So I believe all such forces of good, they led me to the field of medicine and helped me try to make lives better, one person at a time. However, when the virus from China brought death and economic upheaval in our country, it laid bare not only our broken and dysfunctional healthcare delivery system. I believe our healthcare professionals, doctors, nurses, they're the best in the world. And I know doctors, nurses who practice in Europe, South America, Asia. I believe the physicians, the professionals, healthcare professionals, they're the best in the world. But our healthcare delivery system is broken. It's dysfunctional. Um, so, treating patients on the front lines as a cardiologist during the pandemic, as well as managing the pandemic in boardrooms as a chief medical officer, I was chief medical officer of a hospital in one of the epicenters of the pandemic in New Jersey. So I realized that there's a big disconnect between the C-suite and the ground forces, so to speak, who were battling it on a daily basis. I was actually invited to be the chief medical officer of this particular hospital a few years ago when the hospital was not doing well. And I helped with my senior leadership team, of course, to turn around the hospital within a year. It went from a budgeted approximately seven-digit loss to a seven-digit profit. And we did it not because of strategies of just cutting costs and things like that, but mainly by improving patient services, by improving patient experiences. My whole aim of getting the hospital to a better place was to develop patient-centric strategies rather than profit-centric strategies, which a lot of insurance companies and healthcare organizations have, unfortunately, I believe. So we turned it around, and we actually got to the hospital to a stage where we could actually handle the pandemic. Many of the things that people may have heard of, doctors, nurses, respiratory therapists, phlebotomists, dying in New York and in New Jersey in the early waves of the pandemic when the virus was lethal. In my hospital, I took steps where not one hospital employee, died of hospital-acquired COVID. That was because we followed the science. We just did not blindly follow the dictates that were coming from the CDC or the NIH, where they were not following science. They were doing it for convenience, for based on resources. Their policies were based on resources. rather than the science. We followed the science, and we made sure that everybody was safe and our patients were treated appropriately. So I believe, it is time to make systemic changes, cut bureaucracy, ensure accountability, and bring results in real time. I believe it is time to stop the government from disrupting families by taking away individual rights. We should have choices. There's a distrust of. So I do believe that it is time for the big fight, the good fight, for the good of the people, instead of making benefits or trying to do good for the people one at a time. I believe it is time to scale it up, at least for me, from my experiences, and the teachings of my parents and my upbringing. And frankly, there are too many lawyers in the house. So I think it's time for a cardiologist to be in the house, a doctor in the house with a heart and a critical care mindset, because I think that is something that is required. A lot of people have these 5-year, 10-year plans. I think that is more in socialist countries. We are a capitalist, free market democracy. There is no reason to turf off problems 5 years or 10 years from now. We need to address them right now. And I would take that same approach, that when a patient is called for a heart attack, when a patient comes in for a heart attack and I'm called, I don't turf it for the next day or the day after. We take care of it then and now. And I think that is the kind of situation we are in our country, where we need to take real time. We need to take real time steps with real time results. And I think that's what we need to do. Based upon all this, I do have a website which gives detailed information about my 5 major platforms. Not other candidate, nobody else has such detailed website of addressing problems, but I'll briefly go ahead and address them if I may. The first one is, of course, the border security and illegal immigration. And the reason I bring that as the first point is because I believe that in order to have a prosperous district, state, country, it is imperative that we have peace and law and order, because otherwise it is just chaotic and you're fighting these small little problems that come out here and there, and your focus from progress and prosperity is taken away. So you have to take care of that. I believe there's an invasion of illegal immigrants from our southern border, not only from our southern countries, but from all over the world. We've seen people from China over there, people from Asia, different parts of Asia and South America there. So I think that is become, it used to be a porous border. Now it's an open border. We've gone from a few sanctuary cities to multiple sanctuary cities, sanctuary states. And I now believe that we are a sanctuary country, unfortunately. And so I think we need to really have a tough stance on our border. In addition to that, I believe China is pushing drugs, including fentanyl, which is just creating havoc in American lives, using our neighbors as transit points. I see patients with drug overdose, with fentanyl overdose, as patients on a regular basis here in New Jersey. And it is almost like, a death by 1,000 cuts. And I'm sure patients are dying of drug overdose in other parts of the country as well. In fact, just last year, 2023, we had more than 100,000 Americans die of drug overdose, which is all coming from the southern border. So I believe it is not only ruining American lives, it is draining our healthcare resources, our educational resources, as well as it is a national security threat. So we have to stop it. Whether you call it a wall or barbed wire or electronic surveillance or a mishmash of all of that, it doesn't matter. We have to have a barrier. And a lot of Democrats will say, oh, you're going to hurt businesses and the like. But I believe we can walk and chew gum at the same time. We must have exclusive commercial corridors. And anything that comes across that illegally, whether it is drugs or people, if they try to come across illegally, they get automatically disqualified, deported, detained and deported. And they should know that there is a deterrence, that if they try to cross illegally, they will never be able to come back never be able to cross the border, or even if they're found in the U.S. So whether and with consequences, we can provide them the resources without our boots on the ground over there, and make sure that there's consequences at every level, the local level, the federal level in their countries for any transit manufacturing, definitely not allow China to use them to push drugs into our country. The asylum seekers, all the naysayers for a strong drug policy that use the excuse of asylum seekers, again, we can address that in a very logical, straightforward manner. I'm not against asylum seekers, but we need to do that not at the border. Otherwise, we have an influx of people with sham asylum seekers. So we can increase our resources in our friendly countries, neighboring countries, screen all those asylum seekers over there, and the legitimate ones, they should be actually fast tracked. They can be fast tracked rather than waiting for a year or 2 years. They can be fast tracked. So I believe we can walk and chew gum at the same time. We must really have a carrot and stick policy with our neighbors. Otherwise, we'll just having not only an influx of, illegal immigrants, but also drugs, and is just a national security threat, as like I said. A lot of people, they think that drug overdose happens only with people. We see, drug overdose in middle-aged folks. And since 2014, in fact, the average life expectancy based upon the CDC data itself has been decreasing every single year. 2014, 2015, 2016, 2018, 2019, there was a slight improvement. Then again, 2020, it dropped because of COVID. But most of those, the life expectancy, the reason for that life expectancy going down is mainly drug overdose and mental health issues. And it's not just a young people's problem. It's happening in middle-aged women and seniors. So I believe just as our, of course we have to be tough at the border, but to take care of our seniors, just as I believe, when we were growing up, our parents and grandparents, they held our hand through thick and thin, and until we were able to stand on our own feet. And I think that it becomes our responsibility and duty to take care of our seniors, provide them financial security and healthcare security in their golden years. So, although I've done that in practice with my own parents, I see senior patients on a regular basis. I practice in a community which is, full of senior patients with retirement communities. I know I cannot physically be the son of every senior in American, but I can assure you, and I will not let the Democrats give ground on this even a bit. I can assure you that even if I'm the last man standing, I will fight for the financial and healthcare security till the end of time, and that translates into Social Security and Medicare, and I will do that.
I support Donald Trump. I even campaigned and helped knock doors for him, and he was the president in the beginning of the pandemic, and then the election was during that whole pandemic. So the politics ensued, but he takes credit still till this day for saving hundreds of millions of lives. I get it. It's rhetoric, but he's talking about the vaccine or what might or may not be a vaccine. And we can speak this way freely on YouTube because they changed their community standards. There was 3 years ago, we can't have this conversation right now. What's a vaccine? Is the mRNA vaccine a real vaccine? Stuff like that. We couldn't even do that before. We would get banned. But yourself being a cardiologist and a healthcare professional, I didn't get the vax. And there should be a postmortem in all of this. My question for you, and if I cut up, you can just talk about this, is Ronald Reagan, the Ronald Reagan era. He passed this law that made it so Big Pharma could not be sued, was not liable if anything went wrong with vaccines. Now, if there was a bill to reverse that or make them liable, is this something that have knowledge on or you're passionate about?
Yeah, absolutely. And I'll take the first part of your question first about the vaccine that Donald Trump talked about. And when the initial Wuhan strain hit, and then the Delta strain hit in December, January of Wuhan in 2020, and then the Delta strain hit in late December, January. Those were very lethal strains of the COVID virus. So I think given the uh, given the precarious situation we were in with the lethal strain of those virus, and there are more than 1 million Americans dead, by the way, and I believe there's some sort of an undercount of that. So I have family members who actually died of COVID, and I've seen patients firsthand because a lot of COVID patients, they had cardiovascular problems, and as a cardiologist, I was consulted on all those patients, and I saw them firsthand. Given that we were dealing with an unknown, dealing with a very lethal virus, at least the first few strains of those. Right now, there is COVID virus, but they're not as lethal as they used to be. He did put in a lot of money with the companies and got the vaccine in a very short order. Now, given those vaccines were mRNA vaccines, and mRNA vaccines have been around for 10 years, although they've not hit prime time until COVID. So there are some questions about the side effects of the vaccines, especially in young people. In fact, I wrote a book, COVID Slayers. It's on Amazon. That came out before the vaccine. That was published on November 18, 2020. However, I've actually written chapters in textbook on COVID, especially with the cardiovascular part of it. That is for residents, medical students, and physicians. And there's another book coming out where it is about controversies about COVID. And the chapter in that actually I've written is about myocarditis, which is inflammation of the heart muscle due to COVID and due to vaccines. So the data basically shows that, yes, there are side effects of the mRNA vaccine, especially in young people, less than 45 years of age. But anytime you give the medicine or vaccine or anything, you weigh the risks and benefits of what you're prescribing. If I prescribe a high blood pressure medication, I have to weigh the risks and benefits. If I prescribe a cholesterol medication, I have to weigh the risks and benefits. It's only when your benefits outweigh the risk is that you prescribe a medication or vaccine or whatever the case may be. Mm-hmm. So during that first year, the risk of infection and dying of COVID, especially for the elderly population, especially for the people who had multiple comorbidities like heart disease, diabetes, and the like, they were, for them, it was a choice between, the better, lesser of the two evils, so to speak. And so the mRNA vaccines at that time were okay for them. That was the right thing to do. It prevented a lot of deaths. However, since then, if you've noticed, there's been no research and development for any other vaccines. It's the same two vaccines. The Johnson & Johnson vaccine, which at that time, it's no longer approved by the FDA. It's not even available. That was pushed to the indigent population, the African Americans, because it was a one-shot vaccine. And I thought that was a disservice because for prevention and efficacy, the other two vaccines were actually better. But for some reason, they thought that African Americans were less compliant, which I heard in boardrooms myself. And just one shot should be given, which was a less effective vaccine than the other two in that situation. Now, where we have less lethal COVID strains, it's been a long time since COVID happened in the world. They should have come out with better vaccines, protein-based vaccines, other vaccines which are not mRNA vaccines. There's a company out there. I don't want to take names because of they're private companies. I don't want to push one company versus the other. But there's a company out there which is FDA approved, which has vaccines which are not mRNA vaccines. And it's not even being talked about. It's very difficult to even get it in the pharmacies. So, and those are safer vaccines than that particular vaccine is known to be safe vaccine because it's not compared to the mRNA vaccine. The other vaccines that we take, that we've been taking for decades, they are not mRNA vaccines. So I believe it's not the fault of the people. The messages coming out from the healthcare professionals, not the healthcare professional on the ground, but the public health officials and the public officials has been so contradictory right from the get-go that people have lost trust in the government. People have lost trust in public health officials. So half the country believes it, half does not. there was monoclonal antibodies. Half the country believed it, half the country did not. Uh, in Florida and in Texas, there were monoclonal antibodies being given to COVID patients. There was no restriction. Here in New Jersey, it was rationed. We had a hard time getting it. And a lot of people do not know, but if monoclonal antibodies at that time, it not only within 24, 48, 70, 48 hours or so that you got the monoclonal antibodies after getting infected, it not had a high cure rate. It also protected you for the next 6 months. So the current vaccines, even the current vaccines, in addition to the vaccines that were there or the earlier versions of it, they protected you only for about 6 months or so. So you should have given, the government should have given this, I would say, the capability of choosing which treatment that they want. Yeah, there's a big distrust. And even right now, doctors are not allowed to give vaccines in their offices. It's being given by all these, Walgreens and CVS. That
Right.
doctor-patient relationship, that is sacrosanct in my mind. If I tell a patient, take a vaccine, they won't even ask me a question for the most part. Sometimes they do, and I explain it to them. That's my job. But a politician or a public health official who's not seeing patients, who does not know what's going on the front lines, just to ship it to Walgreens or CVS and let them distribute vaccine, that's just and that just is a setup for failure. And that is what it is. Right now, if you look at the data, only about 20-25% of the US population gets a vaccine. The rest 75 does not. And that has percolated into the other vaccines, which are safer vaccines, like the measles vaccines, the mumps rubella vaccines that have been given for ages. And now we're having measles outbreaks in certain parts. They are not mRNA vaccines, by the way, but that distrust has set up in the people's minds.
But
and
those
I think that distrust has to. Yeah.
Those vaccines, not the mRNA vaccines as well, have some side effects as well, right? That's been proven, I'm pretty sure, right? And the question and if I'm wrong, please tell me. Yeah.
Yeah. So the protein-based vaccines, the vaccines that have been given for decades, anytime, like I said, if you have to give a vaccine or a medication, you have to weigh the risks and benefits. And the more common side effects of any vaccine given is so minimal as to say have an encephalitis or measles or chickenpox,
right.
As kids or even adults. Too. So you have to weigh the risks and benefits, and that should be left to the physician and the patient, the pediatrician and the kid. And if the kid is high risk for a vaccine, let the pediatrician decide rather than somebody sitting in Washington, D.C. decide that.
Right.
So that should be given a choice. That should be at a personal level. The Constitution was built on individual liberties, life, liberty, and pursuit of happiness. And we do not want the government to tell us what to give us, what to take, what not to take. The government, just like they do not tell the patients you've got to take blood pressure medications or else, or you got to take cholesterol medications or else. The same thing should be applied to every medical thing out there.
But you mentioned that it was with any vaccine, there's risks. I understand that. But do you think that parents know this when they're giving it to their children? I guess newborn infants too. And if they do know this, does that mean that is sufficient enough why they can't go after pharmaceutical companies that produce these vaccines? That was the question.
Yeah. So the pharmaceutical companies, and it's not just. I would just not keep it at pharmaceutical companies. I would go a step further. Even the insurance companies. If an internist orders a CAT scan or an MRI on a patient, for example, and the patient and the insurance company denies it, God forbid that patient ends up with cancer, that patient cannot go after the insurance company because of the laws that you just cited. And a lot of people think, a lot of internists, a lot of doctors, they order tests just to make money. It does not make logical sense. An internist, if he orders a CAT scan, that CAT scan is done at a radiology facility or a hospital. The doctor is not going to make any money out of that. It's a radiology facility that makes the money. It's a hospital that makes the money. So that internist, the poor internist who's trying to do good for the patient, he has to jump through hoops with the insurance companies to actually get a CAT scan for his patient who is trying to treat the best to his ability. The same thing with the medications. There are new medications coming out, so which benefit patients, but you have to get pre-authorization. You have to get, the insurance companies would not approve it. Who suffers? It's the patient who suffers. Same thing for the vaccines. Now, if there is a drug which is known to have bad side effects, you have to explain as a physician that these are the side effects. Chemo drugs are all there. There are patients with cancers,
Right.
unfortunately, who get very toxic chemo drugs, and they get a counseling before they get the drug. Every single cancer doctor explains to them that this is the benefit that you could get. These are the side effects, and then they go to that next step. Or these are your alternatives. There is a thing called risk, including benefits and alternatives. Every time I do a procedure, I have to explain the risks, including benefits and alternatives, to the patient. And every single physician does that. Every single surgeon does that. And it is up to the patient and the patient's family to figure out which way they want to go. And that is how it is supposed to be. It is known as informed consent. So we practice it on a
Gotcha.
daily basis. So that does not apply to pharmaceutical companies or insurance companies. And if they want to or restrict certain treatments or push certain treatments, then they should be held liable. I agree with you.
Mm-hmm. Yeah, when people find out even that it's a Reagan era policy, they're like, "Wait, how did this happen? How did it go through?" But then I hear that the '80s had some bumping times
Yeah.
in the '80s in America, so I can
Yeah.
imagine things made it through. So thank you so much for joining the NJ First podcast. I know we had some technical difficulty, but if you don't mind, I'll just post this. I can make it the best of our abilities, and that way your voice gets out there. If anybody wants to find you or contact you, where can they find your campaign?
Sure. It's mohanforuscongress.com. That is the website. And you can see me on Facebook, Instagram. You can follow Mohan for US Congress. It's very simple. You just search for Mohan for US Congress on Facebook, Instagram. You will find me. And my site, and of course, the website. The website is very detailed, by the way. Everything that is written on the website, those are my personal beliefs and thoughts. I have a fantastic social media manager who's made it look beautiful and has done a pretty good job at it. But those are my thoughts. It's not a consultant's thought. I'm not a political animal. I sat down and I wrote it myself. And she's actually made it look good, and that's why she's such an asset to the campaign. So I have a great team. We look forward to not only winning the primary, but also taking to the general and winning the general election. I believe it is time for New Jersey to send a cardiologist to the House who represents them, who is working for them. And it's only a 2-year thing. And if anybody knows me, I'm a doer. I'm not a paper pusher. And I do not like pushing papers. Paperwork is not my forte. But I will make things happen, and I will shine light. And the people in Congress, whoever they are, whether they're on the Republican side or the Democrat side, I was told that when you step into Congress, you'll have a decrease in your IQ by at least 10 points. I don't intend to be that person. I want to elevate the other members of Congress and make them realize that they're there not for their own personal agendas. They're there to do the people's work, to serve the people that that have elected them, and that's what I intend to do in my 2 years. And beyond that, if people do not like what I do, please vote me out. But right now, I think please vote me in, because I will make you proud. You will see that things will happen for the people, not only for my district, for New Jersey, and for the country, as well as internationally. Thank you so much, Ryan.
Thank you so much. That's Rajesh Mohan, Congressional District 3, Mercer County, Burlington County, Monmouth County. Make sure to subscribe to the NJ First podcast, like, and share. Thanks for joining, guys.